Tim's patient has not been going to hospital. Now he is being presented with a heart attack. This is because he believes they are scared to come to the hospital. NHS, strict COVID-19 protocols have been imposed. Everyone who is admitted to the hospital must be tested for the virus and kept apart from untested patients to reduce the risk of infection. The stress of dealing with COVID patients mixing with non-COVID patients makes the hospital hard to run. NHS asks trusts to postpone all non-urgent operations to treat COVID patients. London's Royal Free Hospital is now doing half-its procedures. Chase Farm in Enfield colorectal surgeon Darren is dealing with cancer patient 50-year-old Judy. He wants to remove all the tumors out. COVID restrictions cause her a 3-month wait. He performed a colonoscopy interesting a camera into her bowel to see if the cancer has spread. The picture showing the tumor. To remove the tumors, Judy will be doing an operation. Darren says she will be doing a combined synchronous procedure, where 2 surgeons operate at the same time to remove both parts of the bowel. Judy was supposed to be doing her surgery in a private, but she is now being cancelled and will be performed at a Royal Free Hospital. The 7th of September 2020 Royal Free Hospital has had no COVID-positive patients since February. Professor Giuseppe, consultant HPB surgeon, will be operating on Judy when she needs to get rid of both cancers. He must first assess whether the cancer has progressed or not. It was not the case. They removed what looks like a large tumor. Keto now hands over to Darren to remove the tumors in her colon. They were able to get the job done. Now it's recovery. Caroline, chief executive, is responsible for a waiting list of 75,000 patients awaiting treatment. NHS most vulnerable patients will be in a private hospital called Princess Grace Hospital from March. It's deemed to be COVID safe. It has no A&E service and not treating people with viruses. Rented space. This contract was negotiated by NHS England. These companies have been awarded £1.5 billion of taxpayers' money. Private cost will be much higher than NHS cost, says Caroline. Professor Jurg, consultant liver and transplant surgeon. Because of the private sector they can operate on Zabolks, who is 53, diagnosed with bowel cancer. He was due to have surgery on the first day of lockdown. Jurg must remove 2 tumors in Zabolk's liver to halt the spread of the cancer. The surgeons will use an ultrasound scan to locate the tumors. Instead of removing 15% of the liver as planned, they had to remove 65% because the cancer got worse. It could still spread, but everything they saw has gone, which is good news for him. Chris, chief medical officer NHS, informed the trust that they are ending the contract with a private hospital in central London earlier than expected because it's not cost effective. So they will be doing more in-house. They will have to bring back all their private patients, a process that is called repatriation. Emma is the colorectal department's operation manager, responsible for rescheduling the surgery. Matham, clinical director, is struggling to find space to do a colorectal surgery. Director of operations Rachel calls their lead surgeons. She says without the private sector it will be difficult to treat the patients they have. They were relying on them until the end of October. The 7th of September 2020 Royal Free Hospital has had no COVID-positive patients since February. Muhammad ICU matron speaks about how now that all COVID patients are gone, we can now start to work on the other patients who need surgery as a team. Now Rachel needs to work on staff shortages in certain areas. When arriving to do a procedure, a patient must have self-isolated for 14 days and have a COVID test before they arrive. Delays in national testing. Some patients are arriving for surgery without their test results. The most urgent cases need an immediate test or the operation won't happen. In the last 24 hours, Catherine, senior operations manager, spoke about dealing with a lot of patients who ate non-COVID, but the hospital is already full soon. They are finding it hard to know what to do with these surges. She is sure it's not a COVID issue. Tabby, the consultant, explains how the rapids test is done. 13 a day is not enough, she says. theatre coordinator Angeline needed an emergency C-section, so she needed to redeploy staff to assist. Tara, vascular surgeon, talks in a group when her patient can be fit in, arguing that their patients are important to fit in because it has been delayed by 6 months. The patients had to live through lockdown with aortic aneurysms, a swelling of the body's main artery, which can burst at any moment and kill. Tara's patients were too complex in most private hospitals, but were also not deemed critical to a surgery. Instead of working on these patients, she needs to start treating COVID patients. She is now restarting aortic aneurysm surgery for the first time in 6 months. Her first patient is Pat, who was supposed to have her surgery in April. Pat operation can only be done if there is a bed available. In the next hour, Mohammed needs to open up an extra ICU hour to make sure beds are available. During surgery, Pat is fitted with an endo graft, an artificial tube inserted inside her aorta, costing thousands of pounds. It's needed to put in without affecting Pat kidneys. The operation went well. NHS has stopped giving the Royal Free Hospital extra funding, so now they need to make hard choices where to reduce costs.